This issue is the last issue, part 3, which is going to focus on spinal mobilisation. Okay, very important part to work on, especially when doing a lot of exercises. Spine can give us a lot of problems. So today we're going to focus on how to mobilise and open up the spinal column and work on trigger pointing the muscles either side of the spine. So the first exercise we're going to do is called T-spine mobilisation. So we're looking at opening up the thoracic spine and getting better mobilisation through the vertebrae. So to start off, place the roller halfway down your back. We're going to start off feet flat on the floor, cross your arms over your chest, keep your chin tucked in. And all you're going to do is bend over, opening up the spine as far as you can go, remembering not to tilt your head back. Hold in that position for about 30 seconds. You should start to feel it ease off and you'll be able to get a little bit lower. If you feel this quite easy, you can add more pressure on or straighten your arms above your head, still keeping your chin tucked in. Okay, so we're going to use the same technique for rolling the lower part of the spine as well. So we're going to go onto the rough bone roller, lean over to one side, keep one leg straight if you want to add a little bit more pressure, and just slowly roll up and down the lower back, remembering to avoid the spine. If you feel this quite easy, you want to put a bit more pressure, lower yourself down flat to the floor, where you should feel it digging a bit deeper. Hold it there until you start to feel it release. Okay, so the last exercise we're going to focus on today for the spine is how to trigger point the muscles either side. The main thing with this is never roll over the center of the spine, mainly because there's a lot of nerves going down the spinal column and you could cause yourself some damage for rolling over that area. So we're going to focus on going side to side, focusing on one side of the spine at a time. So start off on the upper back, cross your arms over, bring your hips off the floor, tilt over to one side, and then slowly roll down the length of your back. Once you feel the painful spot, hold it until it starts to release, and then carry on until you reach the midway point of your back, and then return up. Repeat this until you've done at least one full roll down and up on that spine. Once you're done, transfer back to the middle and then over to the opposite side and do exactly the same thing. Once you find that painful spot, it might be different from one side to the other, hold for at least 30 seconds until the pain starts to ease, and then carry on rolling, one full length down, one full length up. You can do this as many times as needed until you start to feel the muscles relaxing and the pain starting to subside. Good. Okay, and that concludes our 3-part trigger point therapy articles, finishing off on spinal mobility. Okay, so these exercises can be quite painful, but that means it's working, that means it's needed. Okay, so it might not be helping you towards losing fat or gaining muscle, but obviously the better your body functions as one, and the less injuries you have and the better your movement patterns are, it will actually help you achieve your goals, obviously in the long run, and achieve them in a shorter period, because you'll have less time to recover, so your recovery times will be better, your body will function more efficiently, and you'll be able to get to your goals that little bit quicker.